In terms of an overview of what we'll be covering in today's session, we'll start with introductions, then we'll talk about the background and expectations of the RFA. We'll also talk about eligibility and award information. We'll talk about the requirements for the narrative. We'll talk about the budget, the documentation. Then, like I mentioned before, at the end of the presentation, we'll open up for questions. I'd like to introduce the members of our team who will be participating in today's conference call. Namisa Kramer is the Program Administrator for the Minority Outreach and Technical Assistance Program. Dr. David Mann is the AD College Office. Can you please phone as call? As I mentioned before, I'm Shalewa Noel Thomas, the Director of the Office of Minority Health and Health Disparities at DHMH. So I'll start by providing a little bit of background on the MOTA program. The Outreach and Technical Assistance Program began in 2001 under the auspices of the Cigarette Restitution Fund, or CRFP. It was established to implement the Cigarette Restitution Fund provision regarding outreach and technical assistance to minority communities toward their participation in tobacco and cancer community health coalitions. In 2010, the Department of Health and Mental Hygiene announced the expansion of MOTA beyond tobacco and cancer to other racial and ethnic disparities throughout the state of Maryland. The expanded focus of the program now includes health disparities that affect racial and ethnic minority communities, such as cardiovascular disease, AIDS, diabetes, infant mortality, obesity, and asthma. If we look at the focal areas we are requiring for this year's RFA, they include birth outcomes, cardiovascular disease, diabetes, obesity, cancer, tobacco, asthma, AIDS, health insurance, and lack of a medical home or non-use of a medical home. So applications, we're asking that you focus on one of these topics. In the expected focus of the applications, we expect that in your applications, racial and ethnic minorities and underserved communities will have increased access to community-based health education, increased awareness about the MOTA priority health topics, increased knowledge of the continuum of care for the health conditions being addressed, increased knowledge of prevention, screening, and care resources for the health conditions selected, increased linkage to health insurance enrollment, will have increased linkage to primary and preventive social services, preventive care and social services, will increase assistance with coordination and navigation of primary and preventive health care services, or will have increased health management support through home visiting programs using community health workers or visiting nurses. In applications, it is important for the applicant to demonstrate partnership and collaboration with local health departments, increase partnership and collaboration with other MOTA grantees, health enterprise zones, and other community-based programs, and also to demonstrate participation in technical assistance, capacity building, and program sustainability activities. So at this time, I am going to turn over to Namisa Kramer, who is going to discuss eligibility information, award information, and will discuss some of the other requirements of the application.
Page 7 for eligibility information. And in attachment A, you will actually see in each jurisdiction the minority population in those jurisdictions. And you should be, if your jurisdiction has a minority population of 20,000 or less, then apply for up to $25,000. If your jurisdiction has a minority population of 2001 and above, you're eligible to apply for up to $50,000. And that's on page 7. You have a letter of commitment, and you actually see that in section D. You must provide a copy of your IRS non-profit determination for your organization, IRS Form 990, financial statement, and an audit report if your organization received public funds over $100,000. And for the award information, you find that information on page 7 to 8. You actually give it the most important information, the award information is actually, if you're awarded, you'll be able to renew a grant for FY 2018. That will actually be based on also performance.
Are you?
So for application information, that's on page 8. Your application should be no more than 10 pages long, 12 point font, New Roman, 1 inch margin, and there should be double spaced. And also number the pages sequentially. For your cover letter, we actually have a sample cover letter, which is attachment D, and only a sample cover letter. Please do not use the sample. You'll be disqualified. Just use that sample and write your cover letter. All application forms have a signature of the authorizing official. You should also have your federal tax ID number on the form. Organizational capability actually states your current or previous experience with the target population that you're going to propose in your application. You should also be able to state your ability and experience in promoting health education in communities that in the communities that you work with in your jurisdiction, organization's background, the structure, the mission, and performance. Executive summary, this is page 8. You have to state exactly why the program you're proposing important population that are going to serve. And you should limit your executive summary to 2-3 pages. More than that. So it will be very succinct. I'm going to talk about the application narrative. I'll just talk about the problem statement. Your problem statement should describe the nature and scope of the problem that you're proposing to address in the jurisdiction. And you have to describe the need for locomotor program in the jurisdiction that you're proposing to actually work in, or that community in the jurisdiction that you're proposing your application for. The rest of the application narrative, I'll now actually turn it over to Dr. Mann, our epidemiologist.
speaking about the objectives, the program plan, and the evaluation components, which all should integrate together to describe what the project's going to do and how it's going to benefit the community. And a fairly high degree of specificity in what we're asking for there. And the reason for that is we're in the new world of accountability. Everybody who's spending state dollars asks how much bang for the buck are we getting for that? What's the value we're getting? So as you're writing your application, putting together your plan, imagine from time to time that an auditor will ask you at the end of the program, what did Maryland get for the money spent on your project? You want to be able to provide with a good, solid answer, specify the expenditure that the state made. So, and one thing to keep in mind is activity is no longer considered by most of the people who are looking at accountability to be efficient output. They want some real benefit to go with the activity. So it's actually someone who wrote a book called Trying Hard is Not Good Enough. That's one expression of that sentiment that we're dealing with and how we're being held to account now. I'm now on the page, the slide describing goals and objectives, which is page 10 of the RFA. Ultimately, the problem statement that you're going to end up describing could be expressed as the baseline values of the SMART objective that you're going to propose. And we're going to talk about SMART objectives in just a minute. You're going to have a kind of a broad statement of what kind of health area you'd like to improve during your project. The goal itself could be broad enough that that might not be explicitly measurable, but ultimately you want to select a piece of that goal to turn into SMART objectives that are very specific and measurable and that can improve as a result of your project. So you should be able to know or quickly be able to determine what the value of those metrics or measures that are your SMART objectives are at the beginning of your program. And you may be able to know what the values of those things are at the end of the program so you can get a benefit. I'm going to talk in terms of objectives about the measure and metric are going to come up a bit. I think of a metric or a measure as some characteristic that we can express in a numerical way. Talk about an infant mortality rate, that's a characteristic of a population. We can express it as a number. Prevalence of diabetes, which is the percent of people who have it, or the percent of a population that's in poverty, are also metrics. The metric is a particular level or amount of that characteristic at a particular point in time. So infant mortality in Maryland in 2011 was 12. In 2014, it was 10.6 for blacks or African Americans. They represent specific values at specific points in time of metrics. The benefit is determined by comparing values at one time and the values at another time. So SMART objective. Well, it's going to express as a metric, which makes it measurable. It needs to be specific, so it's not too vague and not ambiguous or not overgeneralized. It needs to get down to some detail. Usually, if something can be measured, it qualifies as being specific. It needs to be attainable or achievable. That's the A in SMART. It has to be realistic to actually make the frame have. It needs to be relevant so that reaching the value will help make progress to your overall goal, and it has to be time-bound so that we know we're going to make a certain improvement in a certain period of time. I think for our purposes, we're thinking about that 2-year time period of getting the initial grant and then potentially qualifying for the renewal. The program work plan, which is going to be the real meat of this, these are the questions: how much of what will be done by whom, when, how are we going to measure that? We want what activities and tasks are going to happen, how much of the activity, how many persons will be reached, who's going to do those things, what the schedule of when the activity is going to happen, and how will we measure how we do all of this. Kind of to design that, this is a table that we used in one of our grants. Listed activities, we listed the timing. It's a nice way to start laying out what we thought our work plan was going to ultimately look like. We had a set of activities and laid them out on a timetable, so this was our Gantt chart for that same project, and you can see we've got a variety of different activities, when they happen at different points in time by month. In the middle, you can see that the educational sessions and the support for Medicaid patients in high utilized constant activities through the whole time frame. Other activities happen more periodically.
Could you ask everyone to mute their phones, please? Their background noise is really distorting your presentation.
I'd like everyone to mute their phones while we're doing the presentation and then open them up again during the question period. For the logic model, that you're going to fill out, there's a template in the RFA, and it's got three main areas. One is the inputs, and those are the resources you're going to deploy to achieve your objectives. Includes like higher time equivalents of your employees, your subcontractors, also find resources from partners. Still getting some background noise. Could everyone please mute their phones? Or if your phone doesn't have a mute system, use *6 on the phone and that will mute it as well. Second element of the logic model are the outputs, and that's what productivity will result from the deployment of resources. That's where you'll express the kinds of activities and many of the activities you'll do and what kind of reach you expect to get from those activities. It might be counted as the number of touches, and you might want to also count that as the number of unduplicated persons that you're reaching. The last logic model are outcomes and impacts. So there are short-term, medium-term, and long-term potential impacts. So short-term things like knowledge, attitudes, and beliefs of people you've been providing education to. Medium-term impacts might be like health, whether people have gotten physical activity, whether they've changed their diet. And long-term might be things like whether obesity has changed or whether the prevalence of other risk factors has changed. So, and impacts could be measured at the level of the individuals that you're touching, or they decide you also want to look at the level of the entire community if there are metrics that are already collected that would describe that for you. Work plan elements, you want to make sure that you include is a brief narrative description of the work plan inside the narrative part of the document. That won't be more than just a general summary. You're going to be needing to complete attachment C, the work plan template, attachment D, the logic model template. You'll need to complete a Gantt chart, and you can use attachment E as an example of what that will need to look like. Include one or more of the 5 activity types, a list that spans pages 10 and 11. And then we'll need to include all 6 of the activities in the list on page 11. Outcomes are the measurable benefits of your project. These are your SMART objectives, and they may also include other intermediate outcomes that are going to be steps toward your ultimate outcomes. And that can be defined for the people that you reach, or you might define it for the larger community. One thing to keep in mind is sometimes demonstrating success for the whole community can be difficult if you're only touching a piece of it. So I think if you do propose community-level outcomes, you probably want to be tracking that same outcome among the people that you've reached. Target population, you're going to need to describe the geographic area for the project. Is it the entire city or county, or are you going to focus on some smaller piece? Describe the characteristics of the people you'll serve. You'll describe them by race and ethnicity, their language is spoken, and their level of English proficiency, and poverty, education, and employment characteristics if that information is available. Number of people you plan to serve, and that should be consistent with your work plan. So when you state it in this section, it should match what's in the work plan. And primarily the project must be reaching racial ethnic minority populations. You're going to want to provide us a list of your project partners. The local health department is a required partner for your work. There's a role of each partner. Again, specifically describe the local health department's role, and you'll need letters of commitment from each partner. See, that's mandatory from your local health department, and that needs to promise what the partner will do, not just say that they think it's a good idea. Management, you're going to need to describe the project staff and the subcontractors. There's 2 funded subcontractors for this award. You want to describe the subcontractor roles and their deliverables. What are they going to be doing for you? Resumes and bio sketches for the key personnel, your own staff, and also key personnel in major subcontractors. Identify the project manager, the clear reporting lines between the project manager and subordinates and subcontractors, and a specification of who's going to be supported by what amount of the project's funds. By the persons who are going to be responsible for the financial management, the fiscal and productivity form submissions, and the interface with our managers of the MOTA program. Evaluation, you want to describe the methods you're going to use to evaluate your success in achieving your objectives. So describe the qualitative and quantitative tools and methods that you're using to measure your outcomes, the data that you're going to collect and how you're going to collect it, and we'll be discussing your evaluation at 3 levels: capacity and development and evaluation, priority and effort evaluation, and outcome and impact evaluation. And we'll specify those in more detail next. So the evaluation is basically matching the inputs part of the logic model, evaluating how well did you deploy the resources that you plan to put into the community. That's part of the evaluation work. Productivity and effort evaluation, which matches the outputs of the logic model. We're talking about how to evaluate how many activities you have accomplished and how much reach in the population you achieved. For outcome or impact evaluation, which matches those parts of the logic model, you'll be assessing what kind of changes in knowledge and attitudes and beliefs occurred in your population.
Remember when we used to live over here? How to get to the apartment?
Can we please make sure we mute the phones, either the mute button in your phone or the *6 within the system. Other impact evaluation could include changes in behaviors, things like physical activity, food choices, etc. And potentially, if project is proposing this, changes you might be looking for in risk factor or disease prevalence. And for dissemination, describe to us how you're planning to inform the public, policymakers, and other key stakeholders about your project, not at the end, but throughout the entire project. So you want to disseminate your milestone achievements during the entire project period, which includes getting operational capacity in place. You might want to publicize a grand opening of something you may be establishing, for example, peer reports on persons served, and end-of-project improvement in outcomes that you had anticipated to improve. Back over to Nita to finish up the presentation.
Okay, so for your budget, actually provide a 12-month line item budget, and you have to look at sample 432B, that's attachment F. And with that budget, you actually have to have an accompanying narrative. And so the narrative is very detailed, and it explains exactly what each line item but figures are estimated for. We'll be doing what activities, and of course, this also is going to mirror what you're going to propose in your work plan. It's your goal, objectives, activities, time, and funds allocated in the work plan. You actually, the link for DHMH fiscal forms 432A to and 433 and 434. Please make sure all those forms are filled out correctly, and you can actually download them and with the hard copies of the application that you to send in. Also, you're advised to obtain accounting services to maintain its general ledger for all related expenses. You're encouraged to call office if you're having difficulty filling out the form. So it can actually help you through the forms, step by step, if you have any difficulty. You can or email me. And they also have DHMH from 432B, that's attachment F, and RFA, and that's just a sample, so look how it's filled out. And DHMH to see, and that's attachment G in the RFA. It's only provided for guidance. And of course, it's stated in the RFA that using this sample in its entirety will eliminate your application from the grant competition. So please do not use the sample. All required original and editable DHMH HSAM fiscal forms can be found on the RFA website. For the budget narrative, we also have budget justification narrative. That's the written justification, and then you'll see the sample attachments in the RFA. You all have to have a sense of commitment, because we have commitment versus support. Commitment is really good state. You're going to have maybe an MOU, or your partner is going to write a letter, and they're actually going to outline the activities that you'll be collaborating on. A letter of support will just your partner will just send out a letter saying that you've worked before and you are doing great work in the community. That they're supporting you and saying, they know about your program and you are doing great in the communities that you are serving. But letter of commitment is different. It's actually your partner study that is going to partner with you. You have outlined activity in the letter of commitment, and we'll see that. And if you have a partner or a collaborator.
Mariah, Taylor, I'm taking you later this evening because I'm waiting for traffic to die now. Okay. Around 6 or 7.
Please mute your phone. We can hear you.
Sorry.
Try 6. Thank you. So you have additional supporting documentation. And you have the local health department support letter. You definitely have to have that. Please do not submit your application without a letter from your local health department. Mandatory forms that you have to definitely send out as the DHMH forms 433 and 434. Make sure those forms are signed before you submit them. And then you have the final one is your grant application checklist. Please make sure you print out that checklist and go over it. Make sure every document that requesting the RFA, you actually completed it, you have copied them, and all in the applications you're going to submit. Thank you very much for listening. So that's the question and answer session.
This is Brett Scarborough at Worcester Youth and Family in Worcester County. I guess our concern is that we have such a short period of time to, sort of get all this together. And see a letter of good standing from the Maryland state government, but, what if they did it to us in time? We have the pressure on them and our local health department to get, things to us and then to you. Could you? Hello?
Yes, can you hear me?
Oh, okay.
Yes, sorry. Sorry, it was actually on mute on my side. Sorry. Yeah. So, please state your question again.
Okay, I guess it was just a concern that we have such a short window of time to get all this together. Like the letter of good standing. We got to get that. And what if they don't send it? And the health department, we got to put pressure on them. We have a good relationship with them, but just a lot to do in a very short period of time.
I think now I want you to concentrate on your application because that is key. Your application to be good. So concentrate on that. And what you can do is maybe write a letter just letting us know that you have actually requested the letter of good standing, and then once it comes, you submit it later on.
Okay.
Yeah, there's that flexibility.
Okay.
And we understand the shorter run, time. So
Right, because we got to mail it in too.
You can,
so that's
absolutely.
A few more days for that too.
Yeah.
So my understanding is you want us to focus on one of these areas, not one or two, but just one area.
Well, if you are good at if you want to write a great application and a great work plan, and you want to focus on two areas, you can do that. If you want to focus on one area, HIV/AIDS, your strength, and you're probably going to serve different populations that are affected or infected with HIV/AIDS. I think that would be great. Yeah.
Okay, so we can do one because there's only many. We're remote and there's a lot of agencies in this area, and not a lot of population, so there's not a lot of different groups that can all do the same thing or can all do different things. There's only a few of us to do everything. So I was wondering about that. That's very interesting.
That's fine. You're on the right track.
Okay.
Mm-hmm.
It's Shelley from Montgomery County. Two questions. The first question is, can you, and I don't know if I missed it, but the letters of support, is that a requirement or is it a requirement for letter of commitment? Or both? Outside letter of support from the local health officer, of course.
In the letter of commitment.
Okay.
Yes.
And the other question is, so are we to apply only within our jurisdiction, or are we able to apply for funding that crosses jurisdiction?
You can only apply for funding for jurisdiction.
Okay. And so one award per jurisdiction?
Yes.
That'll be perfect.
Yes,
Thank
one
you.
award per jurisdiction, yes.
Thank you.
You're welcome.
Lisa, this is Ashira from Dorchester County.
Yes.
Could someone repeat the information about the possible second year? I missed, it was picking up and there was a lot of background noise.
Well, we have done for this RFA, for the 2017 RFA, instead of, sort of like applying, like writing a new application every year, you would have a chance, if you're awarded, to actually just renew for it.
Okay.
Second year, for 2018.
So, Lisa, a follow-up question. So it wouldn't be necessary for us to submit two budgets. You're only submitting a budget for FY17 with the contingency that you can be renewed for funding for 18 at the same budget amount level?
There will be a renewal application that will be required for the second year. However, it will not be a competitive process. The renewal is going to be based on your performance in year one.
Okay.
And yes, we are going to require a budget for the second year.
It's not required to submit along with this application, only one budget, correct?
Just one budget for this year.
Perfect.
Dr. Jeff Mitchell from Riverbrook Church. What constitutes a jurisdiction?
A jurisdiction, as it pertains to this application, is a county or Baltimore City. So what we're referring to jurisdictions is the county.
And a follow-up to that question, I'm sorry, I'm a nonprofit in Baltimore City. Is that assuming then there's only funding available for one grantee per county? there will only be one grantee in Baltimore City, one grantee in Baltimore County.
Yes.
Yes.
Okay, thank you.
Thank you. Thank you.
Maureen McNeil from the hospice in Salisbury. Can you hear me?
Yes, I can believe.
So, is there any way to, and so this would be the local health department, but is there any way to learn who else is an application that we might collaborate at this point? Is there a way to know who else in my jurisdiction is applying so that I could do a partnership from the get-go rather than we all apply and compete with one another?
Where's your jurisdiction?
Based
hello?
We're
Yeah,
based
we
in my company.
have no way of knowing that right now until all the applications come in, honestly. We don't even know who is going to apply.
We're not collecting information ahead of time on what organizations are going to be applying or what jurisdictions represent.
Okay.
Because we won't have that information, then we wouldn't be able to share that with the group.
Hi, it's Shelly again. I have two more questions. The
Yes.
first one, can you clarify for me, I know in Dr. Mann's presentation he had mentioned a 2-year time frame for the SMART objectives that are being developed. So are we doing it again based on 2 years or just the 1 year?
We want to ultimately have a 2-year time horizon, but for something that you're trying to improve 2 years, you're hopefully going to be able to achieve some portion of that improvement for the first year. And certainly for the process and performance numbers, you're going to need to have very specific your performance targets for year 1.
Perfect. And then the second question is, I see noted limit of 2 subcontractors. Are those the same as consultants?
Yes.
So the community partners that will be providing letter of commitments, those are the same as the subcontractors?
Yes, you can have 2 consultants or you can have 2 sub-grantees.
Okay.
Yes, the same.
Thank you.
Just 2, limited to just 2.
This is Michelle from Montgomery County. In relation to that, for the letters of commitment, are we required to have partners or collaborators? I know there's a limit of 2, but if we don't have any, is that acceptable as well, and then not have any letters of commitment?
Question for me?
I know there's a limit on 2 subcontractors.
Uh-huh.
It's okay to submit, would an application with no subcontractors or no partners considered competitive? Or?
Yeah, absolutely, yes. The subcontractors really apply to those entities who, think they need funded partners in order to implement aspects of the project. However, that is not a requirement. So certainly for you, if you're not going to work subcontractors, that is fine. If you have partners who are going to be partnering with you on the program that are not funded to strengthen your application, it would be good to get some kind of letter of commitment from those partners. Does that clarify your question?
Yes, thank you.
You're welcome.
Shelley, again, I have a follow-up to that question. So if it's not required to have sub-grantees, you found non-grant funded partners. I know in the letter of commitment it was that you will list what they would be doing. So the things they would be doing would be in kind because they would be financially supported by the grant then?
Yes.
Yes. Okay.
Yeah, good question.
My name is Zita. I have a question. It might be a silly one. I'm not too used to doing this, but if our organization writes out our plan and we submit that with our application, and say only used one consultant or one subcontractor, And then later on, we needed to bring on another. We did not use that subcontractor or consultant at all?
If you submit your application with one subcontractor listed in your application, and then later on you needed to add another subcontractor, would you be able to do so? Is that your question?
Because I guess in actuality what we're doing is we're planning out the whole year, right?
Mm-hmm.
Okay, so I don't know, maybe I'm the only one that thinks this, but a whole year, I couldn't possibly, what might happen that would come up that we had to add to, an event or something that we needed to get done to target a certain, say something comes up in the county where we want to attend and it wasn't on our calendar to be in attendance, and we can really target the population there, and we needed a subcontractor to do something. How would we do that?
You're kind of describing what I would phrase almost an if and when kind of arrangement. So you're working with somebody who kind of when you need them, but you're not quite sure when you need them, as opposed to someone who you've got a contract for a really explicit set of deliverables for the whole year.
Right.
In that situation, you might have to say, we're going to need to purchase services, might be a better term than contract.
Okay.
So you need to purchase this service maybe 6 times during the year, and each is X amount of money, and that's in your budget. And so it might not be like an ongoing contract, but it might be these very brief purchase of service for very discrete events, sounds like what you're describing. I think if you can express that in the plan and in the budget, that should be okay.
Okay.
Is the form also in the RFA?
Mm-hmm.
At purchase of service. Yes,
Thank you.
But you would have to explain in detail.
Right.
Oh, just to add to that, you would need to, in your application, just explicitly outline in detail what those purchase services would be.
Mm-hmm.
Okay.
Okay?
Thank you.
This is More City. I was wondering if you could shed some light on why COPD is not one of the focal areas.
The focal areas are determined by the data we look at in terms of health disparities and the major health disparities that we're seeing here in the state of Maryland. And I'm going to ask Dr. Mann to add to that. And so COPD did not come up as a priority area for us as we look at the data.
Okay, thank you.
Surprisingly, we don't really see large differences between black and white COPD mortality rates, for example. So there are other areas where we see bigger minority versus white gaps, and we prioritize those ahead of other conditions.
Okay, thank you.
Kitty from Prince George's County. I see that we have 10 pages for our narrative. And I was wondering if the cover letter is, we have the cover letter, and then 2 to 3 pages for the executive summary. Mm-hmm. And we have 13 bullet points in the narrative. Is it set up so that we just basically give a very succinct discussion in the narrative section where the bullet points are, and that we use all the appendices to really describe our program? Is that how you've set it up?
I think the 10 pages is actually going to be your narrative.
13 items to discuss, and 3 pages might go to the executive summary. How are we going to do that? I mean, that's why I was thinking you probably want something abbreviated. Is that correct?
Let's see what the page numbers are here.
Yeah. Just a second.
Thank you.
Mm-hmm.
So the mode application.
So what's this page? So page 8. Page 8.
Yes, ma'am.
The RFA?
Ma'am.
Yes. So the model application should be no more than 10 pages long. This is not including the budget pages, appendices, and written budget narrative justification.
Right.
So in other words, the 2 to 3 pages of the executive summary actually separate, right? It's excluding the 10 pages. We actually want you to just sort of like concentrate on your program. That's pages.
So executive summary it also is not included?
No, it's excluding, yes, you're right. It's excluding the 10 pages.
Okay, we've got 10 pages
yes.
to deal with those 13 bullets.
Yes.
But and the budget narrative is not included, so it's actually only 20.
Not at all, yes. That's good, yeah.
So the cover letter is also not included in those 10 pages?
Not included, yes, not included. Okay. Yeah.
Okay, so we have a full 10 pages for those bullets.
Okay. Yes, so actually talk about your program.
Yeah, goals and the objective. I was looking at the appendix that you sent, which was really like a very high level. All of your appendices are so nicely done. There's going to be a lot of information in there. Want us to replicate it in the narrative will probably take a lot of space. You want us to do that? And I'm talking like cut and paste. I'm talking about going into the depth that those appendices allow us to speak to.
Wow.
Yes. Okay. So what we would like you to do is, like Namita said, 10 pages would be dedicated to the program plan and your narrative, and then definitely want you to complete appendices as we've asked in the application. Now, if that requires information you have already in your narrative, that is fine.
I'm so cutting out. Could you say that more time?
So what I said was, if what we want you to do is to complete the appendices as required in the RFA, and if that requires you cutting or pasting some of the information from your narrative into the appendices, that's fine.
That's great. But so I'm hoping that the appendices will kind of be the proof that we've thought through our plan, because we may not have the space to put it all in. Would that be reasonable?
Yes. That would be feasible.
Right. So the appendices will supplement the information in your program narrative. So that's, you're absolutely correct on that.
Okay. Thank you.
Okay, we have a couple of questions from the chat room here, and the first one is from Ms. McNeil. It says, I'm at a hospice that serves the 4 counties of the Lower Eastern Shore, headquartered in Salisbury. Would you accept an application for a program to serve 4 counties? And I think this was addressed before. What we would prefer for your application is to address one jurisdiction, one county.
Question. This is Nica del Pueblo. I was wondering if you said only one organization will be funded per county?
Yes. Yes.
And even if they're serving different populations, like African American versus serving the Latino population?
Yes.
Is there a minority in each county that is kind of selected to fund?
No.
They're all pre-selection of populations or, to be supported by these funds.
This is a competitive grant fund. This is a competitive grant application.
So the Latino population, even if it's less than African American population in that county, we would still be competitive?
Yes.
Thank you.
Mm-hmm.
Another question from the chat room. Will you be posting samples of proposals that have been successful in the past The answer to that is no, we will not.
And the reason for that is because this application, this IFA is different, has taken a different direction.
The next question in the chat room, are signatures still required in blue ink?
Yes, all signatures should be in blue ink. And the reason for that is, in blue ink, if you put out, it actually shows up. It can come out really good. But when you do it in black, when you create, it fades away, and you cannot see the signature clearly.
Final question in the chat room, how positively do you look at previous or current partnerships for local health departments, but this is the first time applying for this grant? So what we're looking at is really the fact that you do have partnerships, whether they're just partnerships, current partnerships, or future partnerships. And so I say that for this person, John Queen, go ahead and have those partnerships and submit those letters of commitment from the health department with which you're currently working. So it doesn't matter if your partnerships are previous, current, future. The important thing is that you do have those partnerships. The next question is, will your slides from this presentation be available on your website? And yes, they will be available on the website after the call. And the session has been recorded. In addition to the slides, the recording of this conference call will also be available on the website by Wednesday of next week. Our next question is, training allowable as a component of the MODA if the training and those trained work toward reducing disparity gaps? So, Ms. Dotson, can you clarify the type of training you're referring to?
So one of the things that we were looking to do as a part of the MODA grant this year, since the focus has changed somewhat, is to provide DT training for a couple of staff members so that we can then provide that to the community in partnership with a number of other organizations. So the training would be the diabetes prevention training, and so utilizing that type of training to do more work in and around the community.
So your question is, within your MODA application and budget, could you pay for that training for staff members? Is that your question? Ms. Dawson?
That is the question.
Okay, so the training would be allowable if the training is directly related to the program you are proposing in your application. So it's clear to us that training is going to be beneficial to the implementation and to the activities that you are actually proposing as a part of your MODA application.
Thank you. And then the second part of that is, with training, would we be able to, as part of the MODA grant, also include, I guess, courses for those that would participate, because sometimes there's a cost, but if we can offer it through the MODA funding, then we could reduce that cost for those participating in the diabetes prevention training.
About training trainers or training general population?
It would be twofold. We would train the trainers, and then those sessions in the community. The program is a year-long program.
If you're going to pursue something like that, you'd want to be sure that just the number of trainers trained isn't the ultimate output of the program, that you're actually saying, I'm going to try to do the diabetes prevention program with a number of pre-diabetics, which for people who are at high risk for diabetes, and you would talk in terms of how many people you thought you would be able to that program. And training trainers, part of that, and providing funding to cover the cost of the program to the participants could potentially also be a cost that you for.
Thank you.
And next question here is, winning subcontractors, are they required to be nonprofits? And they are. Are the other questions? Well, thank you all for participating in the call. We look forward to receiving some applications that are certainly competitive and very responsive to the RFA. And as you know, the deadline for submitting your applications is Friday, June 10th, no later than 6:30 p.m. If you have questions as you proceed through this process, you may email Namisha Kramer, and her information is posted on our MHA website. So thank you for participating and have a wonderful weekend.
Bye.